Good morning to all. Today's topic is about retinal detachment. What is retinal detachment? We'll see what is retinal detachment. Retinal detachment is a disorder of the eyes in which the retinal pigment layer separates from the sensory layer. So here you can see the retinal detachment. It is a disorder of the eye in which the retinal pigment layer separate from the sensory layer. So retinal detachment is a serious medical emergency where the light sensitive tissue at the back of the eye pulls away from its normal position. Key warning signs include a sudden increase in photo, flashes of light and a dark shadow of curtain over your vision. So retinal detachment definition, it is a serious medical emergency where the retina, the light sensitive tissue at the back of the eye, pulls away from its supporting layer. So retinal detachment happens when the thin layer of the tissue at the back of the eye pulls away from its regular position. This layer of tissue is called the retina. Retinal detachment is an emergency condition. Retinal detachment separates the retinal cells from the layer of blood vessels that provides oxygen and nourishment to the eye. The longer the retinal detachment goes without treatment, the greater the risk of permanent vision loss in the affected eye. So retinal detachment is the separation of the neurosensory retina from the underlying retinal pigment epithelium. If not treated immediately, entire retina may detach, leading to vision loss and blindness. It is a medical emergency. So, you know the anatomy. Light enters the eye and is focused on the retina by the lens. The retina produces a picture which is then sent to the optic nerve. It transports the picture to the brain. If the retina is damaged or not, it is in correct position, a clear picture cannot be produced. The retina is made up of two main layers. There is an inner layer of seeing cells called rods and cones. These cells react to light and send electrical signals via the optic nerve to the brain. So the cones help us to see in the daylight and form color vision. Rods helps us to see in the dark. The outer layer is the retinal pigment epithelium. It is a layer of cells behind the rods and cones, and this retinal pigment epithelium helps us to nourish and support the rods and cones. It acts like a filter, keeping harmful substances away from the sensitive cells. So here you can see the different types of retinal detachment. First one is rheumatogenic retinal detachment, and second one is exudative serous or secondary retinal detachment. Third one is fractional retinal detachment. So here you can see first one is rheumatogenic retinal detachment is the most common and caused by fluid passing from the vitreous cavity via a retinal tear or break into the potential space between the sensory retina and the retinal pigment epithelium. In detachment, fractional detachment occurs when proliferating membranes contract and elevate the retina. When exudative serous or secondary retinal detachment, in that it results from fluid accumulations beneath the sensory retina caused by retinal or choroidal diseases. So retinal detachment is generally classified into three main types. First one is rheumatogenic, the most common type caused by a retinal tear or hole that allows the fluid to slip under the retina. So this is primarily caused by aging, where the eyes gel like vitreous shrinks and tugs on the retina, or severe nearsightedness or myopia, trauma, and previous eye surgeries. Traction occurs when scar tissue on the retina surface contracts, pulling the retina away from the underlying tissue. This is typically caused by diabetic retinopathy, sickle cell retinopathy, or previous trauma. Exudative happens without any tears or holes when the fluid leaks and builds up underneath the retina. Causes include inflammatory diseases, SLE, ocular tumors, or vascular abnormalities. So here you can see the types. First one, rheumatogenic retinal detachment. You can see the retina is detached, fluid builds up behind the retina which is broken. In traction and exudative retinal detachment, fluid builds up behind the retina which is not broken. So here there is a break in the retina. Risk factors: age over 50, previous retinal detachment, family history of retinal detachment, nearsightedness or myopia, previous eye surgery such as cataract removal, previous severe eye injury, diabetic eye, that is diabetic retinopathy or Marfan syndrome. So the causes: lifestyle factors, previous detachment, family history, extreme nearsightedness or myopia, retinal tears, eye surgery complications, eye disorders and medical conditions. So you can see, we will see how high myopia or nearsightedness increase the risk of retinal tears and retinal detachment. Myopia increase the risk of retinal detachment because the eyeball grows too long. It stretches and pinches the delicate tissue of the retina. This elongation makes the retina weak, prone to tears and more vulnerable to pulling from the inner eye jelly. Rheumatogenic detachment, that's aging. The gel inside the eye, that is the vitreous, shrinks and liquefies, pulling away from the retina. This is called a posterior vitreous detachment. Retinal tears are the vitreous pulls away. It can tug hard enough to tear or rip the thin retinal tissue. The fluid seepage, liquid from inside the eye, passes through the new tear, collecting behind the retina and peeling it away from the wall of the eye. Causes of tractional retinal detachment. Tractional is scar tissue. This happens when the scar tissue grows on the surface of the retina and pulls it away from the back of the eye. It is most commonly caused by poorly controlled diabetic or diabetic retinopathy. Causes of exudative retinal detachment. In exudative, we can see fluid buildup will be there. This occurs without any tears or holes. Fluid buildup behind the retina due to swelling, inflammation, injury, or tumors in the eye. Pathogenesis in retinal detachment is characterized by three main mechanisms. In rheumatogenic due to the retinal tear, exudative due to the fluid leakage, or tractional due to the pulling forces. Posterior vitreous detachment. This common age-related process involves the liquefaction and shrinking of the gel-like vitreous humor, which can cause it to separate from the retina. Retinal tears, PVD. So, posterior vitreous detachment can lead to strong fractional forces that tear the retina, allowing the liquid vitreous to pass into the subretinal space, causing a rheumatogenic detachment. Increased permeability of the choroid or retinal blood vessels. Fluid leaks out of retinal or choroid blood vessels. Accumulation of fluid beneath the retina and without retinal tear or vitreous fraction. Then exudative retinal detachment. Fluid accumulation in the subretinal space in the absence or years of traction from the vitreous. Retinal detachment, sight threatening conditions considering ocular emergency. So retinal breaks are sometimes accompanied by bleeding if a retinal blood vessel is involved in the tear. Fluid from the vitreous passes through the tear and accumulates behind the retina, separating it from the back of the eye. As more liquid accumulates, the retinal detachment progresses and the potential to a total retinal detachment. So here you can see the pathogenesis, pathophysiology, mechanism, signs and symptoms and complications. So posterior vitreous detachment, parts of the gel like vitreous humor detach from the retina during rotational eye movement. The vitreous humor moves within the vitreous cavity. Strong tractional force transmitted to retina through remaining attachments. Retinal tear or physical defect in the retina associated with vitreous traction. A defect held upon with vitreoretinal traction. Defect in retina allows the vitreous fluid to gain access into the subretinal space, and it will cause rhegmatogenous retinal detachment. So, in case of exudative retinal detachment, the causes, that is the vascular damage, optic disc anomalies, degenerative conditions, tumor, malignancy or idiopathic, inflammatory diseases or infectious conditions cause increased permeability of the choroid or retinal blood vessels, fluid leaks out of retina and choroid blood vessels, accumulation of fluid beneath the retina and without retinal tear or vitreous traction. Exudative retinal detachment occurs fluid accumulation in the subretinal space in the absence or tears or traction from the vitreous fluid. Then, in case of fractional retinal detachment, ocular trauma or proliferative retinal diseases, diabetic retinopathy, vitreoretinal diseases due to the disease of the back retina or vitreous fluid around macular degeneration, leads to formation of fibrous tissue bands in the vitreous cavity. Bands contract and exert a tractional force in the retina. Retina is pulled off from the choroid layer at the back of the eye by tractional forces without a retinal tear and leads to tractional retinal detachment. So, retina is pulled off. Symptoms are new floaters, flashes of light, curtains or shadow, and blurred sight. Floaters, that is a sudden shower of tiny specks, dots, lines or cobwebs drifting in your vision. Flashes of light, brief streaks of lightning or flickering lights, usually in your side vision. Curtain or shadow, a dark or grey shadow that looks like a veil or curtain moving across your side or central vision. Blurred sight, vision that becomes blurry, hazy or less clear, often in one eye only. Side vision loss, trouble seeing things at the edge of your normal field of, these are the symptoms. So, heavy and drowsy eyes, blurry or low vision, dark curtain in your vision, fish eye vision, flashes of light or floaters. These are the symptoms of retinal detachment. New floaters means a sudden shower of small specks, dots, squiggly lines or cobwebs drifting in your eyesight. Diagnostic measures of retinal detachment. You can see the dilated fundus examination, indirect ophthalmoscopy, that is the gold standard, B-scan ultrasonography, and optical coherence tomography. These are the investigations. Treatment, scleral buckling surgery to relieve the traction by the retina by indenting the sclera. Pneumatic retinopexy reattaches the retina by injecting a gas bubble. Vitrectomy, that is, provides direct access to the retina by removing the vitreous jets. And laser surgery seals retinal tears with focused light. Management. Mainly surgical options are vitrectomy, scleral buckling and pneumatic retinopexy. So, current approach and retinal thermofusion you can see. In current approach, complete vitrectomy, heavy liquid to displace the SRF or fluid gas exchange via the drainage hole. SRF means the subretinal fluid, which is a collection of liquid between the sensory retina and retinal pigment. Laser tear and drainage hole exchange with the long acting gas. In retinal thermofusion, partial vitrectomy is done, drain out of fluid, then RTF, that is the retinal thermofusion, rise the SRF, that is the subretinal fluid, by energizing and liberating water using 1940 nm laser with coaxial low flow air. So here you can see pneumatic retinopexy, the gas bubble. The needle is injecting the gas bubble for the this surgery, pneumatic retinopexy. So this is the pneumatic retinopexy. Vitrectomy is a surgical procedure in which the vitreous gel that fills the posterior chamber or cavity of the eye is removed to treat eye problems associated with the retina or the vitreous. This surgery offers better access to the retina of the eye for different treatments like repair of retinal detachment, removal of scar tissue, and treatment of macular holes. So once vitrectomy is complete, the ophthalmologist will replace the natural vitreous glass with saline solution or gas by the silicone oil. Vitrectomy surgery, removal of vitreous gland followed by filling the eye with gas, air or silicone oil. Vitrectomy surgery steps, tiny cuts are made. The surgeon makes very small openings in the right part of the eye, get gel removed, and then fluid drainage, laser seal, a laser or freezing tool creates tiny scars around the sphere to seal it, and bubble placement, a temporary gas bubble or silicone oil is injected to press the retina against the wall of the eye. In scleral buckling, you can see it's an external eye operation used to fix a detached retina by sewing a tiny silicone band around the white part of the eye, that is a sclera. This band pushes the eye slightly inward to close any tears and let the retina stick back to the wall. So first one is the doctor numbs your eye or local anesthesia is given. Accessing the sclera, surgeon makes a small cut in the clear tissue or conjunctiva over the eye to reach the outer white surface, and finding and sealing the tears by freezing tool, cryotherapy or laser on the outer eye wall around the tear to create a tight scar that fills the retina, and placing the buckle. A custom silicone band or sponge is placed around the eye and stitched into place. And so draining the fluid, excess fluid is trapped under the retina, may be drained. Scleral buckle, that is a surgery. You can see the silicone buckle is kept. So in scleral buckling is an eye surgery used to repair a detached retina by placing a permanent silicone or plastic band around the outside of the eyeball. We gently push it inward and reattach the tissue. So a tiny band or buckle is sewed onto the sclera. Cryopexy is a freezing treatment used to repair the torn retina tissue, seal the layer to the eye wall using scar tissue, and stop the fluid from causing a detached retina. So first the surgeon will give the general anesthesia or numb the eye by the drops, and a freezing probe. A cool touch touches the outside the white part of your eye, right near the tear, and scar formation. The extreme cold creates swelling that heats into a strong scar, acting like a well to hold the retina in place. So a freezing treatment that helps to reattach the retina by causing a scar, that is cryopexy. It's a freezing treatment used to repair the torn retinal tissue by sealing the layer to the eye wall using a scar tissue and stop the fluid from causing a detached retina. Then this is the retinal detachment surgery for pneumatic retinopexy. It's an office-based procedure for certain retinal detachment involving gas injection, tear sealing, and head position. So it is generally used for simple tears located in the upper part of the eye. So first, local anesthesia is given, fluid and gas injection. A tiny amount of fluid is removed from the eye, and a small bubble of gas is injected, and sealing the tear. The doctor uses a freezing tool or cryotherapy or a laser beam to seal the retinal break. Nursing management, nursing diagnosis, risk for injury related to altered vision and surgical intervention, anxiety related to potential permanent vision loss, efficient knowledge related to posture care and activity limits. Complications are infection and endophthalmitis, corneal issues, vitreous hemorrhage, cataract formation, secondary glaucoma, proliferatory vitreoretinopathy, permanent vision loss, and double vision or diplopia. Health education, you have to tell about the warning signs and symptoms, flashes, floaters, curtain. Flashes are sudden bright streaks of light in your side vision. Floaters, a sudden increase in small specks, dots, or cobwebs. Curtain, a dark shadow or blurry wall moving across your sights. Common risk factors: nearsightedness, high myopia, increases the internal eye strain. Age: adults over 55 are at higher risk. History: previous eye surgery, severe injury, or family history. Prevention and care: the steps are examination, get regular dilated eye checkup, especially if nearsightedness. Protection: wearing safety goggles during sports or high risk tasks. Thank you. That is about the retinal detachment. So we have seen the definition or what is retinal detachment. It is a disorder of the eye in which the retinal pigment layer separate from the sensory layer. Types are three types: stigmatogenous, exudative, fractional. And we have seen the etiology as a risk factors. The pathophysiology: etiological factors will lead to retinal atrophy, fraction of the retinal surface of retinal break that will cause degenerated vitreous fluid through the retinal break in the subretinal space and collects as subretinal fluid, and it will cause retinal detachment. We have seen the clinical manifestations, the diagnostic measures, the complications, the management, mainly the surgical management. Surgical management is three surgeries, mainly vitrectomy, scleral buckling surgery, and pneumatic retinopexy. And we have seen the nursing management and the health education. Thank you. Thank you.